Okay, we are live and we are ready to go.
Okay.
Okay, hi Lauren. Hi Molly.
Hi.
Molly, you want to unmute yourself? Awesome.
All right. Hey, everyone.
Hi. On behalf of Decoding Dyslexia Georgia, I would like to thank you all for joining us this afternoon for the Dyslexia Stress Anxiety Connection with Dr. Molly Wolfson Kramer and Lauren Taylor. This is an issue that is very near and dear to my own heart with my own son's struggles. So several months ago when I talked to Lauren about her son and the problems she'd been having with his mental health issues, I thought back to my son's own struggles. So this is a very important topic, and I hope that each and everyone is able to learn something from our amazing presenters this afternoon. And I want to give a thank you to Lauren Sawyer and Joshua Taylor and Molly and Nolan Kramer. I also want to thank the Howard School for originally letting us do the event there in person. And of course, that did not turn out the way we expected it to. And I also want to thank Jennifer Topple, who is at the Howard School. Our co-hosts this evening are the International Dyslexia Association Georgia branch. And so thank you as well to Anne-Marie Lewis. So onward, Lauren.
Hi, I'm Lauren Taylor, otherwise known as that mom that's always posting on social media and everything else. So to Tina's point, my son also has the diagnosis of dyslexia and anxiety, and he decided he wanted to pitch in. So I'm going to play my son's video. So hold on just a second with us. Going to share. All right, here goes my son. Okay. So if there was anything that you wanted people to know about being diagnosed with dyslexia and also suffering from anxiety and panic attacks and all that, what would you want them to know?
Well, like you said, panic attacks. Panic attacks aren't fun. Deadline. The reason panic attacks aren't fun because number one, they hurt. Number two, you don't even know what they're about. Number three, sometimes they can randomly happen. Like say when you're sleeping, you wake up in the middle of the night and you can't go back to sleep for a long time. Anything else?
Well, what would you say about the anxiety part of it during the day, how it plays out at school when you're trying to learn, how it ties in with your dyslexia?
Well, usually when I do get anxiety, about just like even the tiniest things or the biggest things, you can either pick your nails a bunch until they're like this, or pick your lips a lot if you don't have any nails left.
Yeah.
And even chapstick sometimes doesn't help it because you still keep picking at them.
Yeah.
Anything else?
Well, so what happens when you're assigned something inside school and because of you being dyslexic, it doesn't just come naturally to you? Like, how does that?
Can you repeat that?
So when something's assigned to you in school, inside school, like schoolwork, and you don't have like any accommodation for it or anything like that, and you just have to kind of wing it, and it's easier for your friends who aren't dyslexic, how does that play into the anxiety? Like, what happens then?
I feel like my friends are gonna judge me if I don't get a good score or not.
It's okay.
And I feel like if my friends judge me, they won't want to be my friends anymore. And that ties in with the anxiety, and sometimes that can also cause panic attacks too.
Yeah.
Yeah. And sometimes the panic attacks might not even be that big, but they still hurt.
They still hurt?
Yeah.
Yeah. So is there anything that you'd want anybody to know, like, about how they could maybe help kids inside school that don't know how anxiety and dyslexia work in kids? How to best support them?
So like,
What makes you feel better, or what makes you feel a lot better inside school?
seeing teachers smile,
Yeah.
having just talking about stuff and not having to worry about anything.
Mm-hmm.
This is from anxiety, right? Okay.
So you'd want your teachers to smile more and to just,
yeah, and to be nice and friendly,
mm-hmm.
and like get like if they ever assign us work like that you said, I would rather them, instead of me winging it, I would rather them teach me like what the stuff is. And I do have one of my teachers in my grade right now are currently doing this. They are helping me with, I'm not gonna say the specific category, but with stuff. And I've done pretty well in that category. Any other questions?
I mean, reading?
Yeah.
Yes. So do you have any suggestions for any kids on how to
Handle it?
Yeah.
So like tips?
Tips.
Okay,
Look at you.
fidgets.
Yeah.
Fidgets always help. Some chapstick still, even if it doesn't help that much, but it'll still help.
Mm-hmm. Gum?
Yeah, gum, definitely. Rubber bands for your chairs to move around in.
Yeah.
Maybe even sitting.
Yeah.
Like a yoga ball.
What about your journaling?
Journal? What?
What about your drawing?
Yeah, draw.
Does that really help at all?
No, actually, I like doing that.
You just like to draw?
Yeah.
Okay.
Any other questions?
No, that's it.
Thank you.
All right. Bye. Okay. So without further ado, now, Tina, do we want to go ahead and jump into Dr. Kramer's presentation?
Yes, we do.
Okay. So now we're going to start Dr. Kramer's presentation.
Hey everyone, I'd like to thank you for tuning in and being here during this kind of scary time. I hope everyone is staying as calm and healthy as possible. We're excited to be here and we're excited you're here. So before our lives were turned upside down and when we were still planning on doing this talk in person, I had all of these grand ideas about opening the talk with some kind of an interactive activity. So something engaging. And one of the ideas I had was to put a dyslexia simulation up on the big screen. And of course it would be.
All right, hold on just guys. We have to redo that because apparently it was not showing for everybody. So sorry. Okay, we're having technical difficulties. Hold on just a second. Oh, there it goes. Okay, now we're good.
Be this lengthy paragraph. Hey everyone, I'd like to thank you for tuning in and being here during this kind of scary time. I hope everyone is staying as calm and healthy as possible. We're excited to be here and we're excited you're here. So before our lives were turned upside down and when we were still planning on doing this talk in person, I had all of these grand ideas about opening the talk with some kind of an interactive activity. So something engaging. And one of the ideas I had was to put a dyslexia simulation up on the big screen. And of course it would be this lengthy paragraph where the words were all jumbled and letters were even blinking on the screen. And I was going to make you all decode it within a time constraint. And to make it even more stressful, I wanted to play an audio recording that mimicked background noise in a classroom, maybe some feet shuffling or pencils tapping. And of course, the idea was to give everyone a flavor of what it might be like to live with dyslexia and to try and do schoolwork and homework with dyslexia. But at the end of all of my ideas, it just didn't feel right. In fact, it felt pretty impossible to simulate the feelings that individuals with dyslexia and anxiety have, the feelings that they grapple with on a daily basis, for those of us who might not be struggling with those conditions. So I went online and started doing a little digging about what other people might think about these simulation activities. And as it turns out, I'm not alone in my feelings. In fact, right there on the International Dyslexia Association website, I found an article written by an author with dyslexia who had pretty strong feelings that these dyslexia simulation activities aren't effective, that they don't really give us a taste of what it might be like to deal with such a diagnosis. And this author wrote about a simulation that came out in about 2016. So her article is also from that time. She said, and I quote, "Dyslexia is much more than experiencing frustration while struggling to read text. And this simulation offers about as much insight into the dyslexic experience as skipping a meal offers a well-nourished person insight into the experience of starvation." She also wrote, "The two are as different as a 100-yard run and a marathon. It would be absurd to say that someone who has run 100 yards knows what it's like to run a marathon. Claiming that the simulation imparts insight into what it's like to have dyslexia is equally as absurd." So, on that note, rather than starting with an interactive activity, I wanted to open up with the idea that unless you are someone who struggles with dyslexia and or anxiety, you can't possibly know what it's like to live with these on a daily basis. And that makes it all the more crucial for us to educate ourselves and to advocate when and where we can. So I wanted to start by going over some definitions for these three terms: dyslexia, anxiety, and stress. When I was preparing for this talk, I came across a wide variety of statistics on these topics. And what I learned is that the prevalence of these diagnoses that were shared by different resources and different websites varied based on the definition that they were using. And I found a lot of variability in the definitions for these terms. And so I think it's very important for us to use definitions that are based in research and that are from reliable and valid sources. So that first definition for dyslexia comes from Dr. Sally Shaywitz. She is a professor at Yale University, and she's the co-founder for the Yale Center for Dyslexia and Creativity. And her definition for dyslexia is actually several sentences long. I think it even spans a full paragraph. So this is an adapted version of her definition. But she says that dyslexia is a brain-based difficulty, so it's neurologically based, in reading in an individual who has the intelligence and reasoning skills to be a much better reader. And she goes on to point out that there's scientific research that shows differences in brain connectivity in dyslexic learners and typically reading students. The next definition there for anxiety comes from the American Psychological Association. They say that anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical symptoms. They also point out that many individuals who are struggling with anxiety engage in avoidance. So they avoid certain situations based on their worries and fears. And then finally, that definition for stress comes from the American Institute of Stress, and they say that it is a condition or feeling experienced when an individual perceives that the demands or the adversities exceed his or her personal and social resources. They also gave an alternate definition for stress. They say this is probably the most common, and it is a physical, mental, or emotional strain or tension. So based on those definitions, we can now go over statistics now that we're on the same page about what would define those terms. So we know that 20% of individuals have dyslexia. They have a brain-based difficulty in reading compared to other significant strengths in other areas. 30% of individuals are thought to have anxiety, and there are some sources that say that anxiety is the most common mental health issue among children and adolescents. The research also shows that about 20 to 30% of individuals with dyslexia also have anxiety, so comorbid diagnoses. A couple other interesting facts. more than 60% of children and adolescents with dyslexia also met the clinical criteria for at least one additional behavioral or emotional disorder. So this could be clinical depression or generalized anxiety disorder. Some children also struggle with oppositional defiant disorder. And 50% of children and adolescents with dyslexia also meet the criteria for an attentional disorder or ADHD. Okay, so here we have a normative curve. We're going to look at this curve as it pertains to the dyslexic population and their future functioning. Over there towards the left side of the curve, on the far end of the spectrum, we have the less than desirable circumstances. These are circumstances that no one would hope that children would end up in. Now, there is some research pointing out that many students with dyslexia end up dropping out of school. They struggle to find employment. And there also have been some studies done to show that prisons have a disproportionately high number of dyslexic or illiterate inmates. Okay, now all the way on the other end of the spectrum, we have the best case scenario. This is what we hope for our children, that these would be the dyslexic learners that end up successful, happy, confident, maybe even they have expertise in a specific niche or career. And just like on any normal curve, most dyslexic learners will fall somewhere in the middle, more in that gray area. So about 50% of dyslexic learners will fall under the tallest part of the curve. And, you know, obviously this is kind of an oversimplified model for future functioning of dyslexic learners, but the purpose for going over it is so that we view dyslexia through a resilience framework. And what I mean by that is we are looking carefully at the risk factors and the protective factors in these children's lives that can really determine where on the spectrum of future functioning they fall. So risk factors are characteristics at the biological, psychological, familial, even community and cultural levels that precede and are associated with a higher likelihood of negative outcomes. Okay, on the other hand, protective factors are characteristics associated with a lower likelihood of negative outcomes, or they essentially reduce a risk factor's impact on one's functioning. Now, when the risk factors in a child's life far outweigh the protective factors, it is safe to assume that they're going to end up on the side of the curve that we don't want them to end up on. When the protective factors outweigh the risk factors, that is when there are more supports in place than there are risks, they end up on the side of the spectrum we would hope for them. And dyslexia, as well as anxiety, both can be considered potential risk factors. But there's, you know, a lot of good news in the fact that we can provide more protective factors, we can provide more supports and certain kinds of remediation that can help them fall on the side of the normative curve that we would hope. So first I'm going to go through some of the risk factors, both internal risk factors and external risk factors, and then talk about some of the red flags to help us identify anxiety in these children. The risk factors I'm going to review, they're not an exhaustive list, but they're some of the major ones that I've noticed. So a major risk factor, first of all, is the severity of the learning disorder. A lot of parents ask me, is my child's dyslexia mild, is it moderate, or is it severe? We do not have a specific set of criteria that we can base that on, but what a lot of clinicians base it on and what I base it on is how much is the learning disorder negatively impacting the child's ability to perform at their potential or to feel emotionally happy or maybe even emotionally neutral. And when the learning disorders are moderate or even into the severe range, that's when we can say that it's a stronger risk factor than if it were just mild. On that same note, if there are other learning disorders present, if a child is struggling with dysgraphia, which is a learning disorder in written expression, or dyscalculia, which is a learning disorder with impairment in mathematics. The more learning disorders someone's struggling with, again, the higher of a risk factor they become. Emotional disorders, having genetic vulnerabilities to anxiety or depression, also can be risk factors. When children are uninformed about the learning disorders that they're struggling with, they tend to internalize and point blame inward. So they might think, oh, it's all my fault. I'm, a bad student. There's no point in studying. And then they become down on themselves and it becomes an emotional risk. Also, the research shows that there are not many preschoolers who have dyslexia who also have comorbid anxiety. And what the research is showing is that the anxiety develops in these dyslexic learners over time after facing repeated failures or putting forth effort and have things still not go well in school. They develop the anxiety, and they also develop a negativistic mindset. So they engage in a pattern of thinking that is not balanced at all, but instead it's negative and it's anxiety ridden. So there's information out there about the kinds of mindsets that individuals with dyslexia have. And here are some examples of cognitive distortions that they might think. In general, individuals with language-based learning disorders feel that they lack efficacy or the ability to control their outcomes. So when they do well, when they're successful or they earn a strong grade, they tend to say that that was based on luck or chance. That teacher happens to really like me, or they happen to make that test easy that time, or grade my answers easily. But when they fail or when they face adversity, they tend to think that the failure indicates their inadequacy as a person. So these thinking patterns basically attribute their successes to external resources external sources that are outside of their control, while their failures are attributed to internal sources, that it's their fault. They also feel less than others. They feel inferior. They feel different. And because of that, the world seems unfair. There's a little bit of a hopelessness and helplessness that things could improve. If you notice that a child is engaging in these kinds of thinking patterns based on what they say or how they behave, cognitive behavioral therapy can be a great intervention to help these children change the patterns of their thinking. And what a CPT therapist will do is help them identify and catch themselves when they are engaging in this negative kind of thinking. And then once they become masters at catching themselves, then the idea is that you want to arm them with tools so that they can replace the negative thoughts with more balanced thinking. So maybe they even learn how to challenge the negative thoughts and find evidence based on really what's happening and based on logic for why those thoughts might not be true. And then later down the road, the idea is that they can replace those thoughts with healthier ones. And we know that when we think in positive ways, we feel more positive. And when we feel more positive, we behave more positively. So cognitive behavioral therapy really teaches us about the strong link and connection between our thoughts, our feelings, and our behaviors. And again, it can be a wonderful tool for children who have dyslexia as a risk factor in their lives. Okay, here we have some external risk factors. A lack of access to remediation or appropriate educational setting is huge. There's lots of research that supports specific kinds of instruction, specific kinds of programs to help children overcome their learning disorders, their dyslexia. However, not everyone has access to them. And when we cannot provide the tools for a student to overcome the setbacks that are a result of the structure of their brains, they need to school. even when a child has access to remediation or an educational setting that helps them overcome the dyslexia, guess what? The academic demands are constantly increasing. So even once you catch up to grade level, you start the next school year and it's, a higher demand. And so even when they're doing well, they have to keep fighting to do well. And that's a little bit of the uphill battle that is an example of a risk factor within dyslexia. The last few there are social, are socially based. And so when these children are compared to their siblings or peers who are more typical learners, it can be really defeating for them. If they're bullied or teased, certainly that's a risk factor. If there's additional stress at home within the family, if there's a family member who is sick, or if there's a tumultuous divorce, that's added on stress. And of course, the lack of friendships or supportive relationships is a huge risk factor for students with dyslexia. Having someone advocate for them, having someone understand the way that their brain works is really crucial. Okay, let's talk about stress. So the Center on the Developing Child at Harvard has identified 3 categories of stress. We have a positive stress response, a tolerable stress response, and a toxic stress response. So these terms refer to the effects that the stressful experience has on the body and not to the stressful event itself. So a positive stress response is normal. It's an essential part of healthy development. It's inevitable. We cannot avoid stress. Positive stress response is characterized by a brief increase in heart rate and maybe mildly elevated levels of hormones. In these cases, the child can be easily brought back down to baseline by the presence of a supportive caregiver. So for example, maybe starting a new school year with new classmates and a new teacher could be stress-inducing for a child. The fact that they have a parent that's consistent in their lives that say, you can get through this and I'll be there at 3:30 p.m. when school's over to hear all about your day. We'll talk about anything that came up that might have been hard. Another example is getting a shot at the doctor's office. So having a parent sit there and hold their hand for them to get through helps decrease the body's reaction to those mildly stressful events. Tolerable stress response activates the body's alert system to a greater degree. And that's because the stressful event might be a little more severe, a little longer lasting. Now, if the activation of the body's stress response is time limited, and again, if it's buffered by a consistent, stable, loving relationship with an adult caregiver, that can help the child adapt, and that prevents the stress response from being detrimental or having long-term effects on the body and the future well-being. A toxic stress response, on the other hand, occurs when a child experiences strong, frequent, or prolonged exposures to adversity in the absence of an adult support. So this kind of prolonged activation of the stress response systems can disrupt the development of the brain. It can impact cognitive development. It can impact the future physical health of the individual. So while it's safe to say that the presence of dyslexia can absolutely cause stress and anxiety, there's something really hopeful in knowing that we can minimize the extent to which the stressors have a negative impact on the child's life. And we can do that by simply being present and being with the child as they endure the adversity and the hardships, and assuring them that they're going to be okay at the end of it. Okay, so how do we identify anxiety in children? How do we know when it's not just positive or tolerable stress response, but that it's more so clinical anxiety? First of all, we just want to be aware that anxiety is statistically probable in children who have dyslexia. It's also more probable in children who have ADHD. So because comorbidities are so prevalent, you might want to keep an eye on those kids who you know are genetically vulnerable to having the anxiety. Worry has to be persistent and excessive to meet criteria for clinical anxiety diagnosis. So a good way to think about that is that the worry has to occur more times than not for at least 6 months. And usually the worry is out of proportion to the situation. A lot of times anxiety in children can present as irritability, moodiness. They might lash out, which might be out of character. There's also physical symptoms. So crying, headaches, stomach aches. Young children don't have the verbiage to say, I don't want to go to school today. I'm really anxious about performing well on my math test. But instead, they're going to wake up and they're going to say, my tummy hurts. I don't want to go to school. And they might cry. So a couple other red flags in identifying anxiety is when the child is really inconsolable or unable to be comforted by logic. They might require repetitive reassurance because they're asking themselves all of these what if questions. What if this goes wrong? Or what if this person does this mean thing to me? And they tend to answer these what if questions with that negativistic way of thinking. So they're thinking about worst case scenarios. They're thinking about what could go wrong rather than what could go right. They don't really have the skills to challenge themselves and think, well, what if this person says something really nice to me? Or what if I do really well on this test or in this scary situation? They might require extra coaxing to do normal activities or activities that used to bring them joy. You might notice that they're worrying hours, days, or weeks ahead of certain anxiety-provoking events. You might notice that they're excessively concerned that others are upset with him or her, or that people are going to be upset with them. So they might unnecessarily apologize or check in to ask if they're doing well or if they got the answer right. And they also aren't really comforted by logic. So it's fear-based, right? It's not really based on what's actually happening. It's not real. So if you're noticing some of these red flags in a child, again, a cognitive behavioral therapy can be a wonderful intervention, or maybe even just touching base about how they're feeling, making it a point to check in that their emotional sides matter just as much as their academic ones. So here we are at the protective factors. So these are the things that we can do, so that parents, educators, psychologists, tutors can do to help minimize the risk for these children of having dyslexia and minimize the risk that the dyslexia will also cause subsequent anxiety. Okay, so the first thing is to define the dyslexia, define the anxiety, and to educate ourselves and to educate our children. And the first way to do that is to seek a formal, comprehensive psychological evaluation. Not all evaluations are created equally. So you want to make sure you are careful in choosing the professional to assess your child. And having your child tested can be a process. I know a lot of different professionals do it differently, but most commonly you work with the child, or at least in my case, I work with the child for 6 hours total. And depending on their age, I'll break that up into smaller sessions, so they're not required to work or sustain their focus for too long. And then after that, I sit down with the parents for a debriefing that can be, up to 1.5 to 2 hours long to go over all the results. And then I type all the test results up into a lengthy report that is meant to be shared with the child's school, with the educators, with the tutors, with whom the child is working on a regular basis. And a lot of times families will ask me, should I share these results with the school? Should I share the results with the teacher? And they seem concerned about the stigma that might be involved, label of having a learning disorder. But the answer is absolutely yes. You should share the test results with the individuals, the professionals who are working with your child. You've gone to all this trouble and used these resources and spent this time in learning a wealth of information about your child's learning profile, what her strengths are, what her challenges are, what might be holding her back, the ways in which she needs to hear information that will help her process them efficiently, and retain them, and then to recall that same information, to use it as needed or to recall it for a test. And so you've learned all this information, so it's only as helpful as much as it is shared. And I'd like to think that teachers and educators will use that to help your child rather than harm them, that they'll use it as a tool. And I've seen it happen, that they can kind of tailor their teaching or provide certain kinds of accommodations that make learning more accessible for the child. And in the same vein, I'm asked whether the results should be shared with the child herself. And again, my answer is most always absolutely yes. Of course, the age of the child is an important factor. So this information needs to be delivered in an age appropriate and developmentally appropriate way, which is totally possible. So for younger children, what I might recommend is for parents to read a book geared towards that age group, 5, 6, 7-year-olds. And there are a lot of great books out there that are about that same age kind of character who's a young child who has trouble with spelling and trouble with reading, maybe even difficulty learning the alphabet. And the parents can read that book to the child and then let the child ask questions as she sees fit. And so you kind of follow the child's lead and don't overburden with information, but that when they ask, you tell them kind of in an age appropriate way. Everyone's different. We all have strengths. We all have challenges. Your challenge might be learning the alphabet or spelling words correctly. But we know how to help. And that's when you can get them on board with a tutor or whatever your game plan is, a specialized school placement that is going to help them overcome the challenge. For older children, maybe there are some families, some parents and children that can just have this open, frank, straightforward conversation. You can be concise and you can use the word dyslexia and you can tell them, you know, what it means, and that there are also some positive characteristics and traits that can come along with it. Maybe for that in-between age group, not too young, they're not yet in high school, you can maybe tell them what a lot of their strengths are that you've noticed. And they can be strengths that come up in testing in their learning profile, but also they can be strengths that you've noticed just in your daily lives. Maybe they're a really flexible thinker, or maybe they're really patient and kind with their friends. And you kind of build them up and you say, you have all these wonderful traits. And I've noticed this and this and this about you. And the testing told us that you're really good in math, for an example. And then you say, and everyone has areas where they could improve. And for you, that happens to be reading and spelling, okay, or whatever their main challenge is. And again, that's when you get them on board with the game plan you're putting in place. That's when you get them on board with the protective factors that you're putting in place to minimize the negative impact of the learning disorder, and thereby minimizing the negative impact of any possible subsequent anxiety. So along with this topic is to just learn about dyslexia, make sure you have the accurate definitions and that you are accessing the reliable and valid resources to learn about the diagnosis. There are some interventions, some remediation interventions that are proven to help, proven to be successful, and there are some that are not. And so just make sure you know the difference. For those of you who might be interested in accessing books that are meant for children with dyslexia to learn about dyslexia, the Yale website has a wonderful list of suggested readings. Okay, so what we're talking about here is multisensory instruction to help the child overcome the dyslexia. So we're talking about the kind of instruction that can change the neural pathways of the brain and give these children the tools to overcome the dyslexia. And we're also talking about accommodations, kind of like the Band-Aids. They're things that we can do in the environment to remove barriers to learning. And so the way to really remediate and remove barriers is a combination of multisensory instruction. This is research-based instruction and accommodations. So remediation can come in a few different forms. You can have full immersion, which would be a placement in a specialized school meant for students with language-based learning disorders. A lot of times, all of the faculty and staff in these schools have been trained in these multisensory methods, and all of the subjects are taught as they would be in a full curriculum, but through multisensory instruction. So the curriculum is taught in a way that really reaches children with learning disabilities. This would be considered the most intensive form of remediation. Then we go down to an intensive tutoring program. This may look like 6 weeks or 8 weeks or 12 weeks, depending on your child's need. And the tutoring company may recommend the 12-week program where the child comes in for tutoring for 4 hours a day for those 12 weeks for weekdays. And then the next step down would be one-on-one private tutoring, still using a multisensory approach, but maybe in the afternoons after school or somehow incorporated into the school day. Tutoring sessions can be weekly or bi-weekly. I have worked with some families who did put their child into a full immersion specialized school and were considered remediated, and then they transitioned into the mainstream school environment, and eventually came across a class or a certain subject that was very challenging. And so maybe they resumed weekly tutoring to help them get over that speed bump or to remind them of certain strategies that they found helpful. So remediation also needs to challenge in the areas of strength while supporting in the areas of struggle. So really this is talking about an individualized education plan. A lot of individuals with dyslexia are known to have really sharp reasoning skills. They're known to be intelligent, and they have this ability to see the big picture. And so we want to make sure that we are pushing them in the areas where we can push them to be their best selves, to perform at their potential, while also bolstering in areas where they may need a little help. And if the particular school or program where your child attends is unable to provide that kind of individualized education plan, then you might be able to seek ways to challenge your child in the areas where they can be challenged outside of school. So there are weekend programs for learning, or certain kinds of summer camps, certain kinds of ways to have them really hone in into robotics, for an example, or STEM activities, or maybe theater or music, dancing. So you want to make sure and be mindful that remediation doesn't lose sight of really what they're talented in and what they're passionate about. Also, we want to increase the level of task complexity at an appropriate rate. That's probably needless to say, but it is important. And it's the idea that the remediation and the tutoring moves along at a pace that works well for the child. A child who has dyslexia, who has really weak processing speed, may need to move along at a slower pace in tutoring. They may need to really master a certain concept in tutoring before moving on to the next, really master the foundational steps before building on that foundation so that it's really strong. Also to be wary of lengthy breaks from school. So it's pretty common for a dyslexic learner to regress if there's been a long break from tutoring or a long break from school, because remembering those strategies and really holding on to the information they've been taught sometimes can be a challenge. And that doesn't mean you have to spend your whole summers studying and foregoing vacations, but you do want to make sure and have a couple booster sessions when you can, or maybe even every other week, just so that they can maintain what they've already done during the school year. Okay, so here's a slide just on accommodations. This is another way to remove barriers. You're providing environmental supports. These are not cheating, okay? They are leveling the playing field. So really what accommodations do is that they make the expectations in the classroom fair and reasonable. It means that what we're asking of a dyslexic learner is something that they actually can do, that they can level up and perform what we're asking of them. And a lot of times they need accommodations to do that. So these are things like access to audiobooks, so that they can truly get lost in a story and really get to know the characters and the plot and the storylines without being burdened by the actual act of decoding or making inferences or reading between the lines, so to speak. Permission to use laptop computers is a really helpful accommodation for students with dyslexia. Writing can be really difficult because it's multifaceted. You have to think about how you hold the pencil. You have to think about how you form letters, how you indent for a paragraph, the spelling, the writing mechanics, the sequence, that there's a beginning, a middle, and an end, that the writing sample flows from start to finish, that it's organized. There are a lot of things to think about, and taking the burden off some of those things can really help a dyslexic student get what's in here out onto their paper. Permission to use spell check, not penalizing for misspelled words, maybe as long as they're legible or decipherable. Extended time is a common accommodation. Giving them time to actually think about the strategies they've been taught, and then time to implement them and use them properly. Ultimately, accommodations are only helpful if the students choose to use them. And it's quite frequent that a dyslexic learner says, no, I don't want to go in a separate room for testing. I don't want extended time, because they already feel different enough, right? They already feel like they stand out, and all they want to do is fit in. And so they will choose not to use the accommodations. If you know a child where that's the case, I would encourage you to sit down with them and really just have this open conversation where you explain that they simply have different needs, and maybe weigh the pros and cons with them of using certain accommodations versus not using them. Maybe there's one that's really crucial for a certain student. The option is they can feel like a smart kid who uses a laptop, for an example, who might be a little different because they have to use a laptop, or they can feel like an inept learner who can't get what's in here out, but they're not using a laptop, so they don't stand out. So really kind of making sense of what they are foregoing versus what they have to gain, I think could be helpful, especially for our older students. Okay, another protective factor is to really empower these students. We want to involve them in their learning. We want them to understand what their strengths are in any given situation or any given class, what resources are at their disposal, how can they access those resources, who do they need to ask, how do they need to ask. We want to give them the tools to become their own advocates once they're old enough. We want them to know what their islands of competence are. We all have our islands of competence, and so we want to make opportunities for these children to understand what theirs are so that they can monopolize on them and show them to the world. I think a big part of empowering them too is teaching them that mistakes are inevitable, and they're opportunities to evolve and to grow, and to have them kind of look at their own errors and their own mistakes through the lens of, okay, so that happened. So how can I prevent it from happening again? Or what can I learn from that hurdle? And by kind of owning our own mistakes and setting that model for them, we can really show them that kind of growth mindset, which I'm going to go over that in a couple slides. So something else we can do to encourage self-advocacy is to teach them to set goals. And of course, depending on the age of the child, this may be easier or may be more difficult, but you want to kind of teach them to think, okay, what is the first step that I need to take right now to complete this project, or to complete, or to begin studying for this test? And then from that first baby step, once they attain that goal, you say, okay, so what's the very next thing you have to do? So you're providing this external scaffolding for them to learn how to set up timelines, and for them to learn how to set up goals. And the idea is that once they can establish these kind of baby steps, then they can set short-term goals or immediate goals. And eventually they learn that these immediate and short-term goals is what allows them to be on the path to achieve their long-term goals. Maybe the long-term goal is getting through 5th grade. Maybe it's graduating from high school and getting into a specific college, or down the road, maybe even becoming a chef. And so with each long-term goal, there are things that they could be doing right now to kind of show them that there is a light at the end of the tunnel, that this is worth fighting for and working towards. So over on the right side of the slide, there is a cartoon of the biblical story of David and Goliath. And just to refresh your memory, Goliath, this was back in 11th century BC, Goliath was a soldier fighting for the Philistines. And then David was a shepherd boy who was an Israelite. He was not a soldier for the Israelite army, but when Goliath stepped forward to represent the Philistines and said, I'm the strongest soldier here, and I challenged the strongest soldier on the Israelites to fight. And of course, the winner of their fight would win the whole battle. But no one from the Israelites stepped forward except David. And they let him fight because no one else offered to fight, but no one believed that he would win. And it turns out that he did win. So right when the battle between David and Goliath started, he had a smooth pebble and a slingshot, and he shot Goliath right between the eyes. And ultimately, Goliath died and David won the battle. And Malcolm Gladwell, the reason I'm bringing this story up is because Malcolm Gladwell, the renowned author, dedicated a whole chapter in his new book called Talking with Strangers to dyslexia. And he challenges us to really change our perspective of the underdog. Of course, David in this situation is considered the underdog. And a lot of us might think that individuals with dyslexia would also be considered the underdogs. But what Gladwell posits is that David won the battle because in the absence of being physically strong and physically tall, he had to figure out a way and use his creativity and his wit and his determination to figure out a way to protect his flock of sheep. And the way he did that was becoming a really strong slingshot user. And he was able to ward off bears and wolves and all these scary animals that threatened his sheep. And so what Gladwell says is, when there's dyslexia, you can look at it like it's an underdog situation and they're at a disadvantage, or you could look at it like they're at a huge advantage, because in the absence of being really fluent readers or really great spellers, they are forced to develop these other skills and really fine tune them and spend time developing them that will serve them well. And an example here is maybe a second grader who has dyslexia, and she realizes she cannot do her language arts homework. It feels impossible, it feels frustrating. And so she develops these really wonderful communication skills. She becomes a master negotiator, where she talks her best friend into doing her homework for her. A win-win situation, right? And so maybe the second grader gets really good at communicating and negotiating and motivating others. And she may become a world famous entrepreneur. But had she been really great at her language arts homework, perhaps she would not have developed that skill set. So it's kind of an exciting, positive way to view dyslexic learners in that way, that there are advantages to the diagnosis. And in fact, I think when we interact with dyslexic learners through that perspective, through that kind of positive mindset, it makes dyslexia less of a risk factor for them. Maybe even it could make dyslexia a protective factor in a way that they have these beautiful strengths that they can use to become who they want to become. Okay, growth mindset. I mentioned this earlier. This term was coined by Dr. Carol Dweck. She's a psychologist, and basically about 30 years ago, Dr. Dweck and her colleagues noticed that there are some students who became completely devastated when they faced adversity or when they met failure. But they noticed there were other students who rebounded really quickly when they faced failure. And from their work, they coined the terms growth mindset and fixed mindset. So a growth mindset is when students believe that it is possible to get smarter. They understand that effort makes them stronger and smarter. And so they put in the extra time and effort. And guess what? That leads to higher achievement. In a fixed mindset, there are students who believe that their intelligence and their abilities are unchangeable. So in other words, you have a certain amount of intelligence or a certain amount of skills, and you can't do much to change that. So Dr. Dweck, and I think a lot of us would agree that a growth mindset is crucial for a dyslexic learner. I think it's crucial for children in general, but especially when you have that added risk factor of having dyslexia, it's all the more important. And there are a couple ways we can help our children with dyslexia have more of a growth mindset. So one thing is to incorporate the word yet into our vocabulary. There's a big difference between saying, oh, I'm not much of a dancer, or saying, I'm not a dancer yet, because that indicates that you have the power to become a dancer. And the truth is that through work and through blood, sweat, and tears, a lot of us can reach pretty far. So we also want to model a growth mindset. How we talk out loud about ourselves and our own failures can have an impact on the child. I have a feeling that they're all listening and much more aware than we might give them credit for. Also, to help students engage deeply with their error rather than running from it, kind of help them get to the bottom of what caused the error and maybe how to prevent that same error from happening in the future. And to praise wisely. So instead of praising things that we cannot control, things that are unchangeable, like maybe your intellect or your innate skill set, we want to praise things that are within the child's control, like how much effort they're putting forth, what kind of strategies are they using to problem solve, and when their strategies aren't working, do they have the wherewithal to come up with another strategy and give that a try? Are they persistent? Are they focused? Do they have a positive attitude? These are the things we want to be praising our learners for. And also we want to focus on the whole child. Everything from physical activity to sleep to non-academic activities are hugely important. We want our dyslexic learners to know, to feel like they are well-rounded and to know that they have more to offer than just certain grade point averages. So physical activity helps us learn more efficiently. It can impact our cognitive skills, our academic behavior, our ability to focus, our behavior in the classroom or even outside of school. And the National Association for Sport and Physical Education recommends that children and adolescents are getting about 60 minutes a day of physical activity. Sleep, hugely important for both children and adults. So between ages 3 and 5, it's recommended that they get 10 to 13 hours of sleep per day. For ages 6 to 12, it would be 9 to 12 hours of sleep. And for teenagers between 13 and 18 years of age, it's recommended that they get about 8 to 10 hours of sleep. There's a really great TED Talk out there by Dean Bragonier. He's an advocate and an educator. He's someone who has dyslexia. And I loved what he said in his talk. He said, let's introduce these students to the cognitive skill set that they have that is directly a result of the construction of their brains. So let's teach them in a way where it innately makes sense, and let's assess them in a way that really lets them show what they know. Another way to focus on the whole child is to become very familiar with their interests and their passions. And there is a list on this slide from the book, The Dyslexic Advantage by Brock and Fernette Eide. They're both neurologists. And towards the end of their book, on page 207, they list, it's an entire paragraph of interest and passions that they've noticed in their dyslexic clients. And there's a wide variety. You might feel like, well, I'm not sure really what my child's interested in or what they might be good at, but maybe it's going to require thinking outside the box. Maybe storytelling is their passion, the thing that they want to do. And you might just think like that they're talkative, but maybe start to give them space for the things that they really talk about a lot. Maybe it's fashion, maybe it's coloring or crafting. So I encourage you to pay attention to what makes them tick, what makes them smile ear to ear. Okay, also paying attention to the child's underlying emotions is going to be a huge protective factor for them. A lot of times on the surface, a child can appear angry or they can appear short or even sassy. And most often when that happens, there's a lot more going on under the surface. And they may be at an age where they're not even aware of that. But as adults and caregivers and professionals, we can be aware of that and we can interact with them accordingly. So we want to help the child identify their emotions. We want to explicitly teach them coping skills. And coping skills are so individualistic. For one individual, it might be progressive muscle relaxation. For someone else, maybe journaling. For someone else, going on nature walks. And so really kind of teaching them what different coping skills could be, and then facilitating opportunities for them to figure out which ones work the best for them. And then we want to reward them for appropriately implementing those coping strategies. I think just being aware that when we see anger or we see opposition on the surface, that there's some more vulnerable emotions on the inside is a huge protective factor. Paying attention to a child's emotions and making space for them is sending this crucial message, which is how you feel is just as important as how you perform. And I think that all children could benefit from hearing that, but especially our dyslexic learners. Okay, so the point of providing more protective factors than there are risk factors is to help our children get into a cycle of success, as opposed to a cycle of failure where they are engaging in a negative pattern of thinking and having emotional issues as a result. So competence is the best way to eradicate stress and anxiety. Competence can come from a remediation program, appropriate educational setting, competence, maybe even in a non-academic area through an interest or a passion or a hobby. And when we build competence in these children, we build confidence. And guess what? Confidence begets more confidence. So through these protective factors, your child can get into a cycle of success. And Dr. Kandel, who won a Nobel Prize for discovering the central role synapses playing in memory and learning, he said that behaviors and thoughts that relate to hope, love, and happiness can also change the brain, just as fear, stress, and anxiety can change it. It's completely symmetrical. I wanted to share with you the distress model that was developed by neurologist Jerome Schultz, and it's a nice acronym. So he talks about a lot of the same protective factors and game plan that I've talked about here. But I've included a link where you can hear him speak a little bit about each one of the factors in his distress model. And I also want to mention, again, the book, The Dyslexic Advantage by Drs. Brock and Furnett-Eide. Towards the end of their book, they kind of summarize a lot of the internal supports and external supports that they're advocating for. And again, there's a lot of overlap with what I've already talked about here. But the internal supports is that they develop confidence, self-worth, that they learn of themselves as being important outside of school, but also that they have competence in school, that there's a positive attitude and optimism about the future. So that ties into what I was saying about baby steps leading to short-term goals and short-term goals leading to long-term goals, and helping them understand how all of those connect. Metacognition is thinking about thinking. So we want our dyslexic learners to understand that when they come across a problem or a dilemma, a learning hurdle, that we want them to pause and think, okay, this is the problem. Where in my, imaginary toolbox can I pull a strategy or a tool to help me overcome it? And maybe for that situation, it's calling your tutor, or it's asking your parents or your teachers for help. But the idea is that they become thinkers about how they think. That's how they can self-advocate for themselves. Drs. Eide also talk about external supports. So I think I've mentioned a lot now that parents and teachers and caregivers play a crucial role here in supporting children with dyslexia. Also that they're in an appropriate educational setting, that they're being remediated in their areas of weakness, and they're balanced by engaging work in their areas of strength. And again, having a formal, comprehensive, well done psychological evaluation can really help you hone in on what are the specific areas of weakness and what are the areas where they're already excelling, that they can be pushed and challenged. And also we want to notice a child's stress level and respond with great care and attention. So this goes back to the 3 different stress levels. We want to make sure that we are present, that our care is consistent, that we are predictable for our children, that we notice when they're stressed and we kind of intervene, but intervene in a way that still helps them feel in control, and that we're more so guiding. And that's how we can prevent their stress response in their bodies from getting to a toxic level. Okay, that concludes my presentation. I want to thank you again for being here, and I hope you all take care.
Okay, hold on a second. Oh, no. What is going on there? Oh my God, no thanks. It's playing music. I'm so sorry, you guys.
It was conceived at the Gold Coast, right over there on Flamingo.
Oh my God.
And then it was brought.
There it goes. I'm so sorry. There it goes. Okay. We're not going to be watching The Killers after all. So sorry about that. Screen sharing has stopped. Okay. Okay. Sorry, we got a little preview of the killers, I guess. Yep. All right, Molly. Can everybody hear us again? Okay. You guys can't see me, can you? Oh no, you can't see me. All right. Yeah, oh, okay, I'm on. So everyone's telling me I'm on. So now I guess now it's my turn. A little preview. My husband said he was just getting into that, and so is my anyway, okay, so let me hit stopped. Okay. So mine isn't as elaborate as Molly's, but that's okay. So I have some slides that I created. I'm just going to go ahead and start this off stating that dyslexia in my family runs, we mapped it 80 years back in my family now. So it is very hereditary. Anxiety, as Molly mentioned, anxiety is also something that is hereditary. It just kind of depends. Sometimes they can, in our family at least, it kind of takes on its own life, depending on what trigger. I'm so sorry. Just a second. Anyway, so in our family, it kind of takes up on its own life. It has its own trigger, and you just saw me waving my mother out the room. I'm so sorry about that. It's okay. Anyway, all right, I've got a little bit of stage fright, so I'm going to bring up my slides to just kind of like calm me down and simmer me down now, because let's go here, share screen. Nope, I don't want that. So I'm going to show self view. Hold on, everybody. Of course, we had all of this ironed out just as an FYI prior to this, and it now is not ironed out. There we go. Oh, dear God. Okay. I'm going to bring over my slides. And now I'm going to try and hold on. Okay. Zoom meeting. You guys have no idea what's going on right now behind me. It's ridiculous. This is okay. There's the PowerPoint right there. Share. Okay. Hopefully this comes up right and everybody can see it. I'm waiting for my slides to come up. Yay, they're working. Okay, good. Okay, so this is my attempt to rise to the challenge with Molly. I wasn't going to do this, but we decided, or I decided to go ahead because it'll keep me on track because this can go forever. So, dyslexia and anxiety. Well, in my case, in my family, I said this has been mapped back 80 years now, and Molly and Tina both know this, or Dr. Kramer and Tina both know this. You know, I caught on to this at an early age with my son. Mainly just because of the dyslexia / hereditary thing that takes place inside families. I've got numerous cousins, I've got like cousins, aunts, uncles, and in my immediate family, my younger sister would be the amazing, beautiful, dyslexic person in my life that I got to, watch in real time when we were children. So identifying my son wasn't really difficult. In fact, it was actually something I was super hyper aware of watching play out, because he started to display a lot of the red flags at a very young age. And Molly touched on this with hers as well. But so in a lot of our children who have dyslexia and anxiety, or just dyslexia in general, a lot of our children start out in the speech language impairment realm, because dyslexia is a language-based learning disability. So both my sister and my son have the same learning profile. They are both extremely, extremely intelligent. And that's not like me. Brad likes to make fun of it. Let me just roll that back. I've been highly aware for a very long time that my sister is the smart one in the family. I'm able to figure things out, but I'm very much hands-on. My sister could look at something once and she could figure it out right then and there. So the same things were starting to play out with my son at a young age. He got, hit with a lot of ear infections. He had a lot of health issues. He had adenoids removed. He had to have a tongue-tied clip. He had to have 2 pairs of tubes placed in his ears. So all of that kind of comes into play as well. But I'm going to say that with the preface of none of those caused his dyslexia. So none of the ear infections, the tongue tie, the adenoids, the tonsil, or whatever, none of his health, anything caused his dyslexia. His dyslexia is hereditary. I'm just putting that out there for educators and individuals who are new to working with our children. So it's, hopefully that explains a lot. So I'm just gonna kind of move on. So here it is with my slides. All right, so dyslexia and anxiety, how we've attempted to navigate and prevent our child from becoming a statistic inside public school. So, unspecified anxiety disorder, panic disorder, dyslexia, CAPD, sensory processing disorder, ADHD combined type, and Dr. Molly. All of these kind of came together in the same time. So in 2nd grade, my son met Dr. Kramer, and she, between Dr. Kramer, Leslie Stewart, and I think Dr. Montiel also, they all 3 kind of jumped in and worked with my son to diagnose, basically to just do all the testing out there. As Molly mentioned, it was a comprehensive psychoeducational evaluation, but what we were essentially also looking for was anything within that evaluation that could impede his learning or his academic anything. And when you're inside public schools, you also have to consider the OHI or other health impairment factors. Sorry, I'm already speaking IEP language. So what Dr. Kramer and parties were able to do, and also I have to say, I don't think that Carol's actually watching, but Carol Taylor, OT extraordinaire, she owns Play Matters. She also worked with my son that year, and that's how we came to the diagnosis of sensory processing disorder. That's how we also came to even further diagnosis of dyslexia. Then we had a lovely woman, an audiologist that works at Coralwood, come back in and diagnose my son with central auditory processing disorder. So this is, I walked into this whole process with Dr. Kramer thinking I was going to walk out with maybe, I knew dyslexia, but maybe, and also anxiety. Turns out my child had a lot going on. He has a lot of acronyms. He has a lot of, so for those of us in public school, for those of us who have to navigate IEPs, my son, the OHI qualifiers or other health impairment qualifiers actually kind of started to take over the SLD categories for an IEP. And that's a little insane, but that's just the makeup of a lot of our children. So I'm going to put that out there too. So a lot of our children have a lot going on, and they keep it together inside of school 8 hours a day. They hold it together because they don't want their friends to see it. They don't want their teachers to pick up on anything. They just want to be accepted for who they are. And, when you have that underlying learning disability, and then you have all the pressure of trying to fit in and, look normal or just be a normal kid, that's when all these other lovely things start to rear their ugly head, at least in our world. So I can speak for my child. I'm going to go through, the timeline real quick of my son and his diagnosis, So this is how things started with my son. In 2012, my son was granted an IEP for his speech disorder. In 2015, my son entered into kindergarten with an IEP for speech. He was identified with dyslexia and dysgraphia. Unfortunately, they only gave him an IEP for speech, and he was 6. So for anybody that does not believe that our children can be identified and diagnosed at a very early age, my child is literally like a walking, map of how to diagnose a child or not to. So we spent all of kindergarten and what I like to call RTI purgatory, even though we had a general ed teacher and we had an SLP sitting there diagnosing, phonological processing, decoding, just every written expression, every word they use to diagnose a child other than actually saying the words dyslexia and dysgraphia. Those words were used inside my son's intake meetings in kindergarten. And so we spent an entire year with them doing what they call data collection in RTI. And by April of kindergarten, I got so irritated because I knew that my son had it. I just basically said, I'm done. You're done collecting data on my son. Hand me the paperwork so I can sign to consent for you to evaluate my son so we can, actually support what's going on. So, I'm not really going to dive into how long that took. So then that brings us to first grade, 2016. My son received his IEP for the glaringly obvious dyslexia he'd entered into public school with. He was 7. So my son's evaluation took place in September. So we all knew that my son at that point, at least my husband and I, and I guess select people inside his school, we knew in September that my son had been given the diagnosis of being dyslexic. Again, we started seeing words like written expression, auditory processing, decoding, and these words kind of play out later. So we didn't actually get into the IEP for my child's learning disability until November of 2016. So my son spent a significant amount of time not being supported with his for his learning disability. And unfortunately, due to that, and Dr. Kramer explains it a lot better than I will ever. I'm just going to explain it the way I explain it, and I don't put a pretty ribbon on anything. So during that time period, what was going on was the individual that was working with my son, the first grade teacher, and this isn't abnormal, by the way. So when you have a child that has an underlying learning disability and the individual charged with teaching that child isn't familiar with that learning disability, they tend to start doing things like gaslighting the behavior, what everybody seems to think would be considered behaviors. Now, imagine not being able to read, imagine not being able to do anything that your friends are doing, imagine not being able to even do the basic tasks that your teacher, the only person that you want to make happy. Imagine that. And then imagine having somebody spend that entire time, rather than supporting you, they're focusing on your behavior. And so they're saying, things that, are pretty detrimental to a 7-year-old child. Still to this day, my child is very aware of what happened and what was said to him. So my son quickly started to develop behaviors, and we started seeing things at home. I started noticing a lot of triggers, and I started noticing that he was getting overwhelmed quickly. And I started to notice things like that mimicked what some of the behavior mimicked what my younger sister would display when she would just get completely frustrated because she just didn't understand or she just couldn't do it. When we got the IEP in first grade in November, unfortunately, they only put one goal in his IEP to support his dyslexia. The other goal, and this is for all parents, please watch this whenever you do get an IEP. The other goal that was inserted into my child's IEP was a behavior plan. Now, to have a behavior plan or anything of that level developed or even placed inside an IEP, you have to have certain credentials to even work with the child or evaluate the child. And nobody inside my son's school has those credentials. But nonetheless, so my son had a behavior plan inserted into his IEP. And so thus began a very, let's just say a teacher that did not understand what she was dealing with, even though the school psychologist and myself and everybody else was trying to explain to her, this child has anxiety. This child is not defiant. He doesn't have any of the behavior you're talking about. This is not what you think he has. You need to start supporting his dyslexia. Never happened. So my son started to suffer pretty significantly in the mental health arena during that time. I don't know. I'm just now, we're in fourth grade. I'm just now able to go back in and actually talk about this, but this is where I am. He started to really basically take things out on himself. He had no control over his world. He had no way to verbalize what was going on. I mean, again, he was a 7-year-old child, but he had the vocabulary, at the age of 3, by the way, my child was identified with the vocabulary of closer to a 7 to 9-year-old. So at 7 years old, his vocabulary was just way up there, but due to what was going on all the gaslighting and none of the supporting. My son, he was just shutting down, and he wasn't really able to explain to me what was going on. It got so bad that my son started to do something that I would later come to find out would be called self-harming. I didn't realize it was self-harming at the time. Nobody, by the way, nobody in any of my meetings ever told me that what they were seeing or what I was seeing was self-harming behavior. I didn't find that out until later. So my son, there was one particular day when the teacher made a comment to my son, or she made comments, and then furthermore, she sent home graded work. And within that graded work, she took a jab at him in red Sharpie. And I'm just going to scroll down here real quick so you can see what it looks like. So this is what was sent home. And please understand, I'm not doing this to shame anybody. I'm not doing this to upset anybody. But educators do need to understand this. For any educator that is working in public school and you are in the process of diagnosing and or working with our amazing children, I need you to see this and I need you to understand this. Putting things like this on a child's graded work and sending it home to their parents. My kid couldn't read it, obviously, but he saw the red Sharpie and he knew that wasn't good. And what this slide shows is my child's needs and wants. That's the irony in this packet. Anyway, so what it shows is that the teacher wrote messy, very hard to read, erase completely. So those are words you never want to say to a child that's been diagnosed with dyslexia and dysgraphia, but just, bottom line, those are words that can make or break a kid. And I don't say that lightly either, because it broke my child. This was the day that my child came home to me for the very first time, in somewhat of a catatonic state. He was in shock. He couldn't really talk. It took about 2 hours of my husband talking to him to, try and get out what was going on. But because when I picked my son up, his lips were covered in blood. His fingernails, as he showed you in the video that we opened with, his fingernails were just bleeding. And he wasn't able to express anything. It took him hours before he was able to decompress enough just to tell us what was going on. So that's just going to be my hint to educators that come into this world working with our children inside of public education. Please, please, please understand that things like this can't keep going on. And things like this lead to what I am now having to navigate inside public school with my child, because this was the camel that broke the back, that whatever that saying is. This started my everything. This started my advocating for not just my child, but for all children, because I wasn't going to allow it to happen. And I'd already seen this happen to my sister, and I wasn't going to allow this to take place with my son. So I'm just going to go back up to the timeline here real quick. Or right there it is. So we met Dr. Kramer in the summer, or in the first month of school in 2017 in second grade. my son was given his, that was his first evaluation out of, I think he got 9 that year. And he was diagnosed with dyslexia and anxiety and panic disorder by Dr. Kramer that year. In 2017, also in 2nd grade, my son qualified under OHI, other health impairment, due to his anxiety diagnosis. I should also, I literally wrote this, OHI stands, he qualified for 4 other qualifiers. We actually have a 5th qualifier now, and we have, I think now we are up to 3 SLD qualifiers for my son. Again, not abnormal for dyslexic children. So I'm going to go over my facts, just like Molly had her facts, but mine are just kind of not as nice, I guess you could say. Mine are just, I'm going to break this down in the way that it needs to be broken down. And this conversation has to be had, and it has to be had for the sake of our children inside a public school. And anyway, so here's the fact. So before this whole thing started, or before this live feed started, I should say, my bio said, and I do live by this, it's, when my son was diagnosed with dyslexia, it wasn't the dyslexia diagnosis that I was going to lose and that I lost sleep over, because I've already watched this play out once, remember, with my sister and with several members of my family. It's not that. It's the statistics that come along with our children when they receive this diagnosis. So the facts: anxiety is hereditary. Dyslexia is hereditary. Anxiety is the 2nd highest comorbidity with a dyslexia diagnosis. Children can be diagnosed with both as early as 5 years old. Some quick statistics. Our children are 3 times more likely to attempt and or commit suicide. Our children are 3 times more likely to end up in prison. Our children are 3 times more likely to drop out of school. And our children are 3 times more likely to become an addict. Those are the facts, and that's what keeps me up at night, and that's what keeps me advocating for my child and so many other children, because these statistics have played out in my life. And in pretty much every realm, except for prison, ironically. That's my mom started this fight back in the 80s with my sister. And in the 80s, they typically, children like my son or children like my sister, they would go ahead and throw them into self-contained classrooms. Well, my mother was not having anything to do with that. And my mom took on, at that time, they were the biggest school district in the state of Georgia, and they were also the best school district in the country. So my mom took on Gwinnett County with Scottish Rite doctors and everybody else, and basically explained to them, it's not my sister's fault. You need to learn how to work with her. Here's her IQ. Here's what she's capable of doing. So all of these doctors came in on behalf of my sister, and my mom took on a whole school district just like I'm doing. And it was all just to, make sure that my sister was given access to absolutely everything. My mom did absolutely everything that she could do. Unfortunately, it wasn't enough. There's only so much a child can take. And I did ask my sister's permission to talk about this. I'm sure my family is not going to be happy about this, but those that know me, I know Tina and Dr. Kramer know this, but and some others, but I did watch the statistics play out with my sister. I watched the attempt to take her life. I think she was only like 12 or 13 years old. I was 15. And then my sister this amazing, intelligent individual who just has this gigantic, empathetic personality. She also ended up dropping out of school at 16. Now, with that being said, that's my sister's story. And one day my sister will tell her story, but I will say this. My sister has, just like every other successful member of my family, my sister has been able to move up the ranks in the world and, basically give everybody the middle finger that wanted to doubt her or wanted to say nasty things to her. And she's a successful small business owner with her husband. She's, she is not really a fan of people, no offense. She prefers animals. So she is vet tech. She goes to amazing lengths to help animals. I think she's up to, I'm not even going to say how many animals she has in her house right now, but her and her husband, they just kind of collect animals. And my son thinks it's totally normal, by the way. So the statistics and this and the reason that I'm doing what I do, I hope everybody now understands, is because I've lived these statistics. I've seen them play out, and I know what they do, and I know what they do to a family. So I'm going to kind of roll that into my my son now. So this is my son. This is the teenager known as my son. This is what everybody is blessed with, is seeing, right? So this is what everyone sees as a normal 10-year-old, tall, lanky little boy with earbuds, usually always in his ear, watching Netflix, or in our son's case, listening to Beethoven's Moonlight Sonata, because that's just the norm for my child. He has never actually been a fan of any kind of music that is normal for his age. He's always, actually his favorite musician is Johnny Cash. I don't know how to take that, if that's good or bad, but whatever, it's just our son. So this is what he typically looks like. This is what all of his friends see. This is what his teachers see. And when I say that, I mean that because I have sat in, I think I did, I tallied up, I have sat in, oh my God, I think it's up to 50 hours of my life in IEP meetings where where I'm told repeatedly nothing seems to be out of place with my son, that nobody picks up on his anxiety, nobody sees anything out of the ordinary, that my son is very sociable and that he's able to communicate with his friends, and he's always very, everyone always compliments on how well behaved he is, how engaged he is with adults, and how polite he is. And you know what? That's not abnormal either. But that is my son. He is a giant, empathetic, big-hearted, lovable kid, or at least that's what he was. Now, unfortunately, due to a series of events that have taken place, he's kind of grown into this, instead of being that sad, scared little boy that he used to be. Now he is the angry and upset and irritated 10-year-old. Some of that, yes, I'm going to go ahead and throw it out there. Yes, some of that's the tween coming out of him, but a lot of it is the circumstances that life has dealt him with, the triple whammy of all of what he has going on. So this is what everybody gets to see. What people don't get to see is this. This version of my son. So this version of my son, he looks normal again, right? Just looks like he's hanging out with his dad and everything like that. This photo was taken 2 weeks ago, right as we went into like lockdown status. This photo was taken right after my son had had an insane panic attack due to, you know, the news constantly playing about COVID-19, and he was worried that, you know, he was going to lose family members. You know, he was just worried about his friends. He was worried about everything. And then on top of that, you add his anxiety, and then you add in the virtual learning we're going through right now, and you add in all of the work he's having to do. All his entire world has been taken from him. And my child is very routine driven, and that's not abnormal either. He is a creature of habit. Our children do, by the way, display a lot of OCD. And he finds his piece of, I'm so sorry. He finds his corner of the couch, and he just kind of holds up in that area, and then he collects things. So he hoards fidgets. So all these little things that we see over here, this whole box right here is a bunch of fidgets. Is his stuff, and when he needs his stuff, that's usually when my spidey senses go off, and I realize that my son is not having a good time. This photo right here, where I've got the cursor going, this was leading up to school starting back right before Christmas break was over. He is in a state of just like, he's completely overwhelmed. He has his weighted blanket on him. Actually, he has several blankets on him. And he's not okay. And then there's this other photo of him, same day, watching the same movie, and he's picking his lips. He doesn't know I'm taking these photos. He's picking his lips. So we did get, by the way, some of the questions that were asked ahead of time about how you can identify, or how do you watch for anxiety in your dyslexic child. And to that I say, I'm showing you a whole slide of it. Our children, or my child at least, I'll tell you this, is that they fidget. So the video that I played of my son earlier at the start of this is a good example. So during that entire filming, he wasn't even aware that he was moving nonstop. He wasn't aware that he was fidgeting. He wasn't aware that he was cracking his knuckles. It's you know, that's just his new normal. So if you do have a child that's dyslexic, and most of our children, by the way, are diagnosed with ADHD out the gate, not shaming anybody, that's just how it rolls. But the older they get, I will say this, the older they get, it's more the anxiety that starts to become the problem. And so with our son, that's what we see more of now, is the anxiety coming out. So what to watch for? Start watching for patterns, start watching for weird little random habits, start watching for chewing. Chewing is some like weird, I'm not going to call it weird because it's not, but it's an identifier. So if your child chews on things all the time, so I think there's a photo of, yes, so my son in this photo right here, he's chewing on a Starbucks. He is oh yeah, sensory behavior. Yeah, that's a sensory driving behavior. You're right. So my son is chewing on a Starbucks stir right here. So he does that because we've literally gone through every kind of what they call chulery out there, and none of it seems to be hard enough for my son. My son is able to do things like crack a lightsaber, like one of the really expensive lightsabers. If it's sitting next to him, he's going to put it in his mouth and he's going to chew on it. And a lot of that has to do with, there's a sensory aspect to it, but there's also an endorphin that's released when they bite down really hard that kind of like releases like tension, and it kind of makes it soothes them. So that's something to watch for, is the chewing. And the fingernails, if you start seeing them do their fingernails when they're specifically like when you're watching them do homework, or when you're watching them do something as simple as try and read a book, or I say that jokingly, obviously, but when they're reading a book, or when they're doing any kind of writing assignment, it doesn't really even have to be academic related. If they start chewing their fingernails, if they start, if they start biting their lip, if they start biting the inside of their lip, all of these things are little indicators. I'm not saying that just rush your kid automatically to a therapist, by the way. I'm just letting you know that these were questions that were asked, and I'm letting educators and parents know that these are things that you can look for, because I'm told over and over again inside the 50 hours of my life that I'll never get back, that my child never displays any signs of anxiety. And yes, I'm highly aware of that, because he's very sneaky with it. He wants to hide it. He doesn't want people to see it because, like he said in his own words, he's scared people will judge him. So those are just some of the things that you can look for. And my son, it's a little bit harder because he's got some pretty significant things going on other than anxiety. You know, he's now got, he's got some elevated levels of things that, you know, are troubling. He's, I mean, just to put it, I will put it out there. Handling anxiety and dyslexia inside of public schools has ended up in a place where my son is now hovering in that trauma area. And for me to say that, I'm not, you know, exaggerating. It's literally Dr. Kramer administered an amazing test. By the way, it's called the MASC-2. And when you're 10 years old, you're allowed to take this test. So she administered this for my son. And there's a self-administer part. So my son has to fill out a part. And then he also has to answer, I think, a series of 100 questions with Dr. Kramer. And, you know, it kind of dives into the psyche of a child. And it's a very, very, you know, highly sought after test. Is actually really up there and one of the best tests that I've actually come across. And trust me, I see evaluations from people all the time. But this has been the most in-depth thing I've ever seen. So it really digs in to see if your child is dealing with like what levels of anxiety are they dealing with, what's elevated. The reason my child doesn't have a general anxiety diagnosis, by the way, is because he's got anxiety in all kind of areas. But it also dives in to see if there's any depression. It dives in to see if there's any kind of like defiant behavioral concerns in there. My son came back with, you know, just elevated levels in areas that, you know, I don't really want to get into, but I'm sure that people have, you know, seen or heard me talk about it. I'll let, you know, just put it this way. When I heard the word psychomotor, or when I read the word psychomotor agitation and psychomotor restlessness, I had to Google that because I didn't really know what that was or what I was dealing with. And it's not really fun to find out that it was attached to my child's everything. So that's what we're dealing with. And that's what I have to deal with inside the public school, is trying to get a lot of administrators and a lot of educators to understand that our kids, you know, can lose it at any second. And you saying something as simple as suck it up can ruin their day. That could be the end of their day. They could go home and they could just not ever be able to recover from that comment because they've just been pushed too far at that point. So I was going to roll into this real quick. So we have, I have this video I'm going to play, and please understand that I don't share these things often. But I have hours of these videos of my son. And I do it because when I go into these 4 to 6 hour IEP meetings, I have to play videos so people actually understand what I'm talking about. So this right here would, and hopefully everyone can see it. All right, so this is my son. This is when he's spiraling. This is right before school started. So what he's doing with his hands and his arms, he's not even aware he's doing it. This is, that's all the OHI he's got diagnosed. That's all of it playing together, but that would be the, well, Dr. Kramer and I are kind of going back and forth with this, but we believe that is actually the physical manifestation of his anxiety and everything else. That would be an example of psychomotor agitation. For parents out there with autistic children, it resembles a lot like or presuming, and that's very much what it looks like. But again, he doesn't know he's doing it. So I'm going to kind of go to some of the good things, because I kind of keep drilling into what all my child is dealing with. But there's a silver lining. The silver lining would be this amazing individual right here. That is my sister. My amazing sister. She has hovered over my son literally since the day he was born. And it's not that she's picked a favorite between both of my kids, but my son my son is very much like her. So she understands how to support him. She understands how to have conversations with him that his friends aren't able to have with him. And that's not me being mean to his friends, by the way. But my son is a kid that likes to come home and watch TV shows like The Universe or Planet Earth. Hold on just a second. So my sister, we have the privilege of having somebody in my immediate family that can help support my son. And she does. She's his biggest cheerleader. She literally, if she could, she'd give him anything, to be honest. And she tries to, trust me. Lots of animals. But the similarities between my sister and my son, they were both diagnosed or identified in kindergarten. They have identical academic profiles. They have identical strengths and weaknesses. They were both gifted with very loud mothers who demanded their children not be ignored or dismissed. They were both gifted with mothers whom refused to take no for an answer. They were both gifted with mothers that picked fights with school districts. They both had doctors and therapists go up against public schools to shed light on what our children were capable of and what could happen if things didn't change. They are the reason I decided to pick up where my mother left off, and will continue to advocate and demand change for our children. They are 28 years apart in age, but when they're together, you'd think they are siblings similar in age. So keep in mind, 28 years apart, and here we are. My sister is 37, 38, I don't know, don't get mad at me. Nothing's better. And inside public school, nothing has been fixed. I mean, we have all of this amazing legislation that's taking place, but it's not, we are so desperate to have legislation that we're taking what we can get, and we have to keep pushing to make it better because our kids are worth it. And I don't ever want to think about a child, being broken to the point that they think that they can't control their world, or that they can't do it anymore. I will say this about my son is that we did at 10 years old have to make the decision. It wasn't taken lightly, by the way. These were questions that were asked too. we had to make the decision to medicate our son at the age of 10 years old. Mind you, we asked our child how he felt about it because, again, my son's 10, but it's more like we're dealing with a 20-year-old. And, you know, he knows how to verbalize everything. He knows how to get it out, and he knows how to tell you how it makes him feel. So, you know, I kind of stayed in touch with Dr. Kramer between his first evaluation in August of 2017, and then, you know, from then up until his latest evaluation in December of this year. And, you know, she kind of made mention every now and then, like maybe he needs this, or maybe we can try this. And, you know, shame on me because I didn't do it early enough, but I was honestly, you know, I was thinking as a mom, I had dyslexia or not dyslexia, I had anxiety as a child. So I was trying to teach my child coping skills and I failed miserably. So we had to medicate my child at the age of 10. He is currently taking clonidine. And if anybody knows what that is, it's a blood pressure medication, but it's now starting to be widely used within the area of ADHD and anxiety. So because when you have ADHD and anxiety, you have to be very careful not to medicate your child on something that's going to exasperate the anxiety. So if you give them a stimulant, that's going to send them through the roof and they're going to be a completely different kid. So you kind of have to find that happy medium. So we tried both versions. We tried the daytime version, and then we also tried the nighttime, we call it the nighttime version. And my son decided that he liked the nighttime version because he didn't like being sleepy during school. And I come to find out he was also apparently yelled at school because he fell asleep on the daytime version. But since he's been on this medication, it has slowed his panic attacks down to a minimum. But they have now come back. So we now have him in therapy with Dr. Kramer. He's now doing cognitive behavioral therapy. And we are really hoping that that is going to replace some of the really bad with some of the really good, because that's what he needs. So that's another option. And I can't say that enough to parents who want to know what you can do without medication. I never thought I'd be that mom placing my kid in therapy, but here I am, and I'm not ashamed of it. And I'm happy I'm doing it. And my son's happy that I'm doing it because my son needs the relief. And so that's where I'm going to leave it. And I'm going to go ahead and shut this PowerPoint presentation down. And let me see. Hopefully this works, you guys. I'm so sorry. This is not working the way it was supposed to at all. So new share. We're going to go back to. Okay. Tina, do you want to take over?
Sure.
I would hit stop share, but I'm scared it's going to bomb everybody out.
Let's see. Viewing options. Let's see. Oh, stop participant sharing. Okay.
There we go.
There we go. Hello.
So sorry.
That's okay. So to our viewers, if you have questions that you'd like to pose, if you can type them into the screen on the Facebook chat, we can answer your questions.
What are we actually sharing on the screen, by the way, because I can't tell.
So right now it's just you.
Right now it's me. Awesome.
And now it's me.
Okay, good. Okay, cool.
So we seem to be rotating.
Oh, okay.
Oh, it does it automatically.
We're doing the speaker. Oh, look, there's Dr. Kramer.
Hello.
Hi. We're doing the gallery view now. So there we go. We are in big full screen mode right there. So yes, if there are questions.
Okay, oh, Joshua's telling us it's whoever talks goes up on the screen.
Thank you, honey. I appreciate it. Okay.
So are there any questions out there? Are we people not typing fast enough? Because nobody likes dead air. So I want to again thank everybody for participating, Dr. Kramer and Lauren Taylor for sharing your stories. And thanks also to IDA Georgia, International Dyslexia Association of Georgia's branch. And they do a lot of great outreach events. And unfortunately, this past Saturday was supposed to be their Dimensions in Dyslexia conference, and it unfortunately had to be canceled because of COVID-19. So that is one of the sad side effects of what has forced us into the online attempt to do a webinar. Leanne Tripp, Connor. Yeah, that she's made a comment. Thank you for sharing your story. My oldest with dyslexia is 7 and the other is 5. It's great to be prepared for what we may be facing. And I agree. That's the hard part, is just the not knowing of whether things are going to go sideways for your child or not.
And Tina, you can even share about that too.
Well, yeah, we went sideways really early on. My son was diagnosed at the age of 6. We knew that there were problems at 4 in preschool. Again, early diagnosis and early intervention are the key. And the speech language pathologist who did a little quick and dirty summary for $25 in the preschool said he doesn't know any of his letter sounds. And so we went to the school and through the child find mandate, and did, at the age, I think he had just turned 5. So he wasn't yet in, he was still in preschool. And we did a speech language pathology evaluation. And unfortunately, Georgia's speech language pathologists are not, those who are employed by the school districts are not required to take the American Speech and Hearing Association's dyslexia educational path. But there is an educational path for speech language pathologists to take to learn more about the identification of and treatment of dyslexia. And because my son did not do poorly enough, he didn't qualify under the child find mandate for early intervention services. Kindergarten, we had him evaluated right after his birthday, and of course he was. And so that was the start of our story. And now he's in 8th grade and he's in the place he needs to be. And it's still difficult. I mean, he has a lot of unfortunate learned behaviors, avoidance. He has obsessive compulsive disorder. So as a result, some of the things that he's experienced in the educational setting have been very damaging. It took us 8 years. Talk about gaslighting, lots of it. And I was getting it from therapists and pediatricians and psychiatrists. And I kept saying, what is this? What is this? What is this? And nobody could answer. And unfortunately, it took someone touched my son's shoe at school, and he lost it in a very dramatic fashion. And unfortunately, that was what led to us, my taking him to the 3rd psychiatrist and saying, you know, I really need you to believe in me and believe that I am telling you what I'm seeing. You really need to believe me, and because this has been driving our lives. And so that's the hardest part, is that the behavior component for some of these kids is so challenging because someone wants to call them oppositional defiant, and that's the worst label you could possibly give to a child, especially one who's young. And here, take some ADHD medication. Well, that made him rage when he got home. And, I never knew who I was getting off the school bus on a given day. And that's the tragedy of it, is that our kids are trying their hardest, and they really have great difficulty with the entire process of going through school. Let's see, I have a couple questions.
Did we have any from the,
Oh, the spreadsheet that we got
Yeah.
earlier.
yeah, did you want to answer any of those?
Yeah, I'd be happy to do that. I don't have it pulled up right in front of me. I don't know if it's easily accessible to you.
I can email it to you real quick.
So someone says, is there a list that you can share of therapists who are particularly good at working with pre-adolescents and adolescents with these things going on? My daughter also goes to therapy, but I often wonder if CBT would work well for her. Finding qualified folks who deeply understand what these kids are experiencing is not easy.
Absolutely. I'm happy to share any referrals if anyone wants to send an email to my work email address. Then, I'll try and hook them up with resources that I know of.
Dr. Kramer's really good, by the way. Hold on. I'm trying to find the email that we were sent. Tina, do you have it on hand real quick?
I do not.
Let me see if I can get it.
Let's see. I need to plug my laptop in because its battery is going. Okay.
I see where it came in. I just can't find the actual attachment.
That's exactly what is happening on my end. Let's see. Oh, I found it.
Yay!
Okay.
Oh, I did too, just as you did. Okay, cool. All right, Molly, I'm gonna let you do this one.
All right, let's see.
Kick them to me and whatever you want me to answer.
Okay. Well, it's hard to pick one because this is an interesting one. Let's see, there was one about anxiety being more prevalent now than it has been in the past. Or, the question was, why are we seeing so much more anxiety now than before? And anxiety can be caused by two different things. So one would be a genetic vulnerability, and the other would be environmental stimuli, or anxiety can be caused by some combination of those. And it's very unlikely that the genetic part of anxiety would have increased significantly over time, because genes just don't really change that much. And so it would have to be in the category of environmental stimuli. And I think one part of that is that people are talking more about emotions. It's becoming a topic in the workplace. It's becoming a topic in schools. People can go online and read more about it and connect with others that are, countries away that might be struggling with some of the same issues. And so, I don't know that it's actually more prevalent. I think we are just more in tune, and it's becoming less of a taboo topic, and maybe more people are seeking help or wanting to learn about it. People are talking about it more. And so I see it as a good thing, hopefully, as opposed to something that's just kind of overtaking the world and would be a negative thing.
Hmm. So here's one, Molly. How can we tell if her anxiety is related to dyslexia or just general anxiety?
Okay. Yep. That's a good question too. I would say that I would encourage the parent, or is that an educator, parent and educator, to look for patterns. So if anxiety is being presented behaviorally or verbally or however, to pay attention to when it's really rearing its head and notice the activities that the child is on their way to or have just come home from, and see if they're all related to schoolwork and homework, or if you're also noticing it in social situations or extracurricular activities. And I think that would give you an idea of really what it's about. And that then should guide treatment.
So what behaviors are masking the learning challenge? So that's a parent / educator. And I'm just going to say this, like I said in my presentation, and I'll let Dr. Kramer finish it off, but the behaviors masking the learning challenge, they can present in all kind of ways. And I don't know, on any given day, you can, like Tina even said, your child can come home with something new every day, or you don't know which version you're getting. It's really just like a gamble. It's like playing dice sometimes, or just rolling the dice, because my son was being sitting there labeled with being defiant. He was being labeled with just horrible like ADHD behaviors and all of these things, and turns out it was a whole slew, as you all saw, of a bunch of things going on at the same time, that as he was trying to also cope with his dyslexia. So at any given time, one of those could flare up, or all of them could flare up at the same time, and then we would get the inevitable. He comes home to me, gets in the car, and we have a 20-minute panic attack, hyperventilating, like crying situation going on. That's just some of the ways that I've seen it, but I'll let Dr. Kramer also go on that one.
Mm-hmm. I think it totally depends on the child and what their kind of common tendencies are for the maladaptive coping skills. And so I think behaviors like avoidance avoidance of what you're not strong in can come up. I think a tendency to be silly or goofy, like a class clown, can come up, because again, it's taking the focus off their areas of weakness and maybe getting some attention. And even though sometimes it's negative attention, for some children that's better than none. Crying, I think. I also think some somatic behaviors like tummy aches, headaches, depending on the child, these are all behaviors that they might exhibit to take the focus off the learning issue that they're having. And so I think it's a great question. I think everyone, maybe even teachers especially, could be mindful of that. So they're not mislabeled, like Tina's son was mislabeled as having oppositional defiant disorder. I think that's probably common. And that's why we need to look under that anger iceberg to see what vulnerable emotions they might be having that are so much deeper and more complex than just anger or opposition or defiance. It's usually not that black and white.
Okay. We have one saying, better understand the anxiety and OCD symptoms my child is starting to demonstrate.
Yeah, that's tricky, because when you start getting into the nuances of what kind of anxiety it is, that's when I lean towards consulting with a professional who knows all about the different kinds of anxiety, and really getting the kind of treatment that research suggests works best for that kind of treatment. What might be a good treatment for social anxiety or generalized anxiety might not be the best for OCD, for an example. So I think think that's my recommendation, but maybe Tina has something to add on that front. You have some experience there.
You're muted.
Yeah, I'm unmuting myself. Yeah,
sorry.
I think that what you need to do for psychiatry in particular, there are very few child psychiatrists out there. And one of the problems that I've experienced and hear from other parents in this space is that a lot of psychiatrists don't accept insurance. So you're winding up talking about trying to find somebody who can see your child, who is currently taking new patients and has a financial arrangement that is suitable for your family, because not everybody can pay for out-of-pocket expenses for literally everything. And that is really puts parents in a really difficult bind, because there are so many questions you may have, and a pediatrician is kind of the gatekeeper to all of those sorts of high-level questions. And a pediatrician might be able to start you out on a medication course or start to discuss some of these issues. But once you get past a certain point, psychiatrist is going to be your best in the line of defense, because they have a better understanding of all the intricacies. And that's what I found. And we at first went to a psychiatrist who completely insisted a long time, for a couple of years, that my child, it was just ADHD. It's just ADHD. I'm like, no. You see him coming into your office and he either is clinging to me like Velcro, or he is throwing himself against, like trying to stimulate himself and get sensory input from your sofa. And that is not, this is not my child. He is clearly very anxious being in this office. And then the second psychiatrist we went to didn't have, I mean, she had good advice, but she just didn't click with him, and he didn't respond positively to her, and her medication choice was not getting at the root of the problem. It was kind of it took the edge off, the same way someone might have a cocktail to take the edge off of some social anxiety and suddenly, temporarily feel calm. And that's what this particular doctor's recommendation was, and was not what we really needed. Intensive advice. And so it wasn't until I was dialing for dollars one day, because I knew that we were really in deep in the weeds and needed somebody. And I wasn't happy with the talk therapist that we were working with. And I wound up just on a whim calling a doctor who I had heard of from my brother, and said, by chance, are you taking any patients? And he said, actually, I have an opening tomorrow at 2. I was like, oh, well, I'll be over to talk to you about his case at 2. And so that's how we got in. And that's one of the bigger challenges, just the getting in.
Okay.
Absolutely.
So what would you tell a parent who has just had their son diagnosed with dyslexia?
I would personally find anything that you can do at home to work with your child. In the meantime, sometimes it takes a while to get a tutor lined up. Again, money can be an obstacle. And one of the things that we have on the Decoding Dyslexia website is a list of resources of free and low cost things that you can do for your child. And it's also noted in the notes section of the Decoding Dyslexia Facebook page. And it is, I believe the title is Resources for Those New to Dyslexia. There are things that you can do that are inexpensive. There are things that you can do that are wildly expensive. And you need to make a decision for your family, what works for you. Online tutoring may be a better choice for your child, especially if transitions are difficult or you have other needs within your household where you can't spend the time in the car 45 minutes each direction for an appointment. So we actually are doing online teletutoring and have since last June, and that has eliminated a big stress point in our household, was the to and from the tutoring session and the wasted time. You know, ask if you have questions about who you might like to approach for a tutor. You can always shoot us a question at the Decoding Dyslexia Facebook page, and I can tell you several options that exist here in Georgia.
Absolutely. That's wonderful. And I would add to that is being okay taking a little bit of time sinking in the news. It's a lot to wrap your head around. It's very overwhelming. It's a very complex topic. Dyslexia looks different on every individual who is dealing with it. And so I think it's okay to take a step back, educate yourself, wrap your head around all the different things, all the different directions you could go, all the different ways to remediate. And at the end of the day, you know, just like Tina said, is do what's best for your family. And it has to make sense logistically. It has to make sense financially. Your child has to feel comfortable with the tutor or the mentor that you're connecting them with. And part of it may be a little bit of a trial and error process. And that's okay too, to be really gentle with yourself in that way. That everyone's kind of figuring it out, and there are people to help and there are resources out there if you do end up having to go a different path.
Yeah. So y'all, we're at 7:59. So
There was one more, a really good one.
oh, okay, one more question. Final one.
Because I didn't get to do this because we had to cancel, or y'all had to cancel the
Live event.
yes. So somebody asked information regarding IEPs related to anxiety and dyslexia. I have a Facebook group and page. I'm not going to plug them right now, but I'm just going to say that there are a plethora of individuals out there that have tons and tons of knowledge when it comes to this, and everything that I've learned has been trial by fire, promise you. I did have an advocate. Hi Brenda, I'm sure you're watching. And I also have my friend Ryan, who sent Brenda my way. So between Brenda and Ryan, I learned my way around IEPs with a child diagnosed with dyslexia and anxiety. And the only thing I can really tell you that's ever worked with that combination is my son finally in 4th grade found somebody that he trusted and he felt safe with, and he finally decided to open up to her. And between her and then you know, it was just coincident. I'm just going to put this out there. We haven't found anything that helps inside public school when you deal with both of these together. It's kind of like the unicorn theory. And I know Tina keeps looking at the clock, but I'm just saying it's like a weird unicorn theory to educators out there. And it's not like our kids, this whole like outdated profile of our children drives me insane. Our children are riddled with anxiety, you know, OCD, mental health, everything. There's a lot that comes with our children. And if I could just get educators and administrators to understand that when you're dealing with a dyslexic child, you need to really, really, really put effort and support that other OHI, being the anxiety or the OCD or whatever. You really need to put the effort into supporting that just as much as you're supporting the dyslexia, because if you're not supporting one, the other one's going to drop off, and you never know which one's going to drop off first. And when they do, it sucks. But all I can tell you when it comes to IEPs relating to anxiety and dyslexia is they're messy. You end up in 4 to 6 hour IEP meetings. And you end up with like 12 people from your school and your district inside your meetings, and you bring donuts. I'm so sorry. Yes, I do that. But I was just going to speak to that part. But, you know, also be organized. Any piece of paper that comes home, that is your data. Right? So that's your data, because when you have a child with an IEP, you have to have some sort of data to see if they're making headway on their goals. Any piece of paper that comes home, get a really good hole puncher and invest in some binders. I don't have any of my binders here with me, but just start, you know, organizing them. Organize your binders. Make sure you keep every single report card that comes home, every single progress report, every single thing, put in that folder for that year. Organize
Everything in writing.
everything, and that too. Get everything in writing. If they try, and I'm probably going to get blasted by somebody on my text message for saying this, but if they try and call you, don't answer. Send an email and let them know whatever they need to tell you can be addressed in writing, that you're not taking their phone call. I say this and this because that is your literal ammo. And that is like how you are able to do these things. And also, if you're inside IEP meetings, record. Georgia is a one-party consent state. So if somebody inside of a meeting says that you're not allowed to record, it's not really up to them. It's actually law in the state of Georgia, so you can. They're also able to record you as well. Just watch the fine print and make sure you have access to your kids' everything at all times. So I have everything up in the iCloud on my phone as well, and binders. So I'm able to access everything at all times. But no, I've never found anything to actually address the anxiety dyslexia part in an IEP at the same time, which is why my son's going to Howard. 5 years. Done.
Well, thank you. Thank both of you, both Molly and Lauren, for agreeing to do this and making it fun. And we learned so much. And this has just been a blast. So thank you so much.
Thank you, Tina.
Thank you,
See you later. Bye.
Bye.